to a baby, considering we're an adult, that doesn't look so scary, right? But that's probably more about what the size that it looks like to the baby, size-wise. It's not a benign procedure. It is deeply impactful and just about unnecessary. There are entire countries that do not have bulb syringes, and you know what? Everybody's still alive there.
Doing this vigorous kind of suction is not considered medically supported anymore.
Just coming into their body, these circulatory pathways are opening. The baby is going from having fluid in its lungs to having air in its lungs. Its senses are being turned on. And it is true that babies have in utero the capacity to hear and smell and see and taste and touch. But it isn't until really they come into air where those senses are really firing up. The American Academy of Pediatrics Neonatal Resuscitation Program guidelines, which state that if you have a vigorous baby at birth, you do not have to suction on the perineum. When this comes at you, how does that feel? What's going on in your body when you just see that coming at you?
That baby's already breathing and coughing and sputtering and crying and breathing it all in. You are not going to be able to alter whether or not it gets this dreadful thing called meconium aspiration. And that most of them don't, thank God. We don't see it very often.
And the NRP doctors responded with yes. That's exactly what the studies show and what the recommendations state.
What's his name? It's just falling into it. Otherwise, you don't care. But this one's Pop it up, buddy. Yeah.
First of all, this is a very vigorous baby, a term baby with good color, good tone, obviously breathing because it's crying, right? And so now, 4 minutes after the birth, they're suctioning, which is against, first of all, the American Academy of Pediatrics Neonatal Resuscitation Program guidelines.
We're going to make sure that he's all clear from the meconium that we're doing there.
Okay, baby, okay.
No suction?
Okay, I'm
She had the full nail. Turn it on.
okay.
Somebody else asked a question. Perineal suctioning is no longer recommended, but should we instruct delivering physicians to change their practice and stop perineal suctioning altogether? And he said, suctioning is no longer recommended because it does not seem to alter the course or the development of meconium aspiration syndrome. However, it is not contraindicated, and many obstetricians will continue to do it.
Do you agree that it's not contraindicated?
Well, it has a deep impact on babies. In the experience of the baby, is it's fast, it's shocking.
You getting any suction?
It's overwhelming, it's a boundary violation, it is deep betrayal.
You got to get breath, you know.
What's happened is you're stimulating the cranial nerves that are not meant to be stimulated at birth.
Somebody doesn't want us to put that down.
It doesn't alter it. So doing this vigorous kind of suction is not considered medically supported anymore.
The American Academy of Pediatrics guidelines are, if you have a vigorous baby, you do not have to suction. So one, they're doing it 4 minutes later, but also, it's totally inappropriate. This is a fine baby.
It's unnecessary. It's medically unnecessary. It was evident that there was some practice being done on that baby.
What do you mean by practice?
Practicing of putting this, this suction in.
Then, if you look at the studies, which the Clinics in Perinatology Journal put out in the March of '06 issue was all on resuscitation, and they did a review of the studies that were done about suctioning. They looked at the vigorous baby, they looked at the non-vigorous baby, they looked at suctioning on the perineum, they looked at intubating, and they looked at amnioinfusion. And they said none of it affects the incidence of meconium aspiration syndrome.
It's unnecessary. They're routines that because they get established because of volumes that come through, and because this is kind of normal routine for us because we're working here, we see it every day, completely forgetting that this is the birth of this newest family member here.
Yeah, terrible.
More bulbing. More bulbing.
But while you're holding the baby, I'd rather.
There is no reason to be balding.
Hey, Mr. Bubbly.
20 minutes.
Yes, Mr. Bubbly.
Go home. Will you stay with me?
Baby's having a little difficulty. You hear him go do the little grunting like,
I'd like to say, of course he was grunting.
do it. Do a grunt.
After all that, wouldn't you be grunting?
Yeah.
For sure. Yeah. Oh. And this is what happens to most babies born in America.
Here, just unwrap him and let's do his weight, and he'll stop it, hopefully.
Well, that's her other Christmas present. That's his mom's Christmas present.
What a good Christmas present.
Honey, what a good Christmas present you got.
Are you gonna put a bow tie on him? Put him on the tree? Did you put up the tree?
That's the grunt.
Yes, it's very traumatic, and it stays in the baby's body.
My mom expressed that the variety of his foods was pretty limited, and eating was a concern at home because he just wasn't interested in eating. We got into doing some feeding therapy along with the language therapy. He was frustrated, and family was kind of frustrated trying to help him, and there just wasn't a lot of communication. It was just trying to deal with his behaviors and figure out what he wanted.
And having worked in it as long as I have, it hurts me that it's not recognized and respected, that we can do it. We could do some very simple things that did honor that baby, did honor the mother and her experience, and support it in quiet, gentle ways that would benefit all these things we know. And it would not be a real huge sort of thing to be doing differently, except in the mindset.
And it's true, there are some complications, but it is rare.
to go to my website and read for themselves the various effects of clamping a cord too soon. There are on my website portions that can be printed out for the informed consent of anybody having a baby. These forms can be printed out and handed to the obstetrical personnel in hospitals, telling them that the cord is to be clamped according to these directions on the form. Patients have every right to refuse medical treatment and to refuse to have the cord clamped in the usual and customary manner that is being done in hospitals. And the hospital is under legal obligation to inform the patient truthfully about the consequences of clamping a cord too soon.
She got the full nail. Turn it on. Award.
Okay, good.
Complications are really rare. Resuscitation is pretty rare. I mean, really. Think of it this way. Birth was set up to work in case nobody's there.
Did your daddy? Oh, there you go. Yeah, get all that yuckies out of there. There you go. Good job, buddy. Good job.